Letrozole versus clomiphene for infertility in the polycystic ovary syndrome. Letrozole. Letrozole is used to treat breast cancer locally advanced of metastatic positive for estrogen receptor or hormone receptor unknown, so only to postmenopausal women. It can be used as first-line treatment. Clomiphene. Clomiphene is a medicine non-steroid for fertility. Thus, the thyroid gland to release hormones to stimulate ovulation, the release of an egg from the ovary. Clomiphene is used to cause ovulation in women with certain medical conditions, such as polycystic ovary syndrome that prevent ovulation which occurs naturally. Letrozole versus clomiphene. Clomiphene is the current treatment of infertility of frontline in women with polycystic ovary syndrome. Both of the aromatase inhibitors as letrozole would result in better outcomes of pregnancy.
Hi, my name is Randall Roy, and I'm an infertility specialist in Orlando, Florida. Today we're going to be talking about some medicines that many of you are familiar with, Clomid or Femara. The generic names are clomiphene citrate and letrozole. I'm going to be talking about the mechanisms of actions of both of those, but first you should know that 40% of infertility is due to ovulation dysfunction, a disorder of ovulation. Many of those are polycystic ovarian syndrome patients. Now, Clomid has been around since the early 1970s, and the newcomer, Letrozole or Femara, has been around and in use since the late 1990s. Should you use one or the other? Well, your doctor is the best one to make that decision for you based upon your age, your height, your weight, your ovarian reserve, and other factors. So let him or her make that decision for you. But I'm going to talk a little bit about Clomid first, then Letrozole, then we're going to go to the mechanisms of action. Clomid is prescribed usually 1/2 tablet to 2 tablets a day for days 5, 6, 7, 8, and 9. It can be days 4 through 8 or 3 through 7, but for 5 cycle days a month, you would take a tablet or 2 tablets. Then you would use an ovulation prediction kit or have an ultrasound, whatever your doctor decides, and you time your relations. So let's talk about Clomid. Clomid is an oral medication. It's inexpensive, it's readily available, and it has very few side effects. Probably 1 in 5 women might have some side effects in terms of its anti-estrogen ability, meaning maybe some hot flashes or night sweats or vaginal dryness for the first couple of days. Then those symptoms might flip completely as the estrogen rises and maybe doubles over normal. Clomid will cause ovulation in 70 to 80% of women, and 30 to 40% of those women will actually conceive. Letrozole is also an oral medication. It's less available and certainly more expensive. So why would one take Letrozole over Clomid? The chances of having twins, 0.9%, less than 1%, whereas the chances for twins with Clomid is 7 to 8%. I've even had a couple of triplet pregnancies on Clomid. And I'm not trying to scare you, but it is possible. In the 13 years we've been using the Letrozole in our clinic, we've only had 5 sets of twins and no triplets. Now, a little bit about the mechanism. This is something that you can use at your next cocktail party and amaze your friends, if not your boss. So, clomiphene actually blocks estrogen receptors at the hypothalamus and at the pituitary. Estrogen is made by these cells we've talked about before, the granulosa cells, and estrogen feeds back to the pituitary and to the hypothalamus, the area that controls the pituitary. But it's blocked out by Clomid. So even though the estrogen level might be normal, the brain is sensing low estrogen. It sends out a signal increasing the follicle-stimulating hormone. Follicle-stimulating hormone will then come down and increase the number of granulosa cells, or even cause one of these lesser follicles to develop, hence the possibility for twins. So you'll stop taking the Clomid, and then we would anticipate ovulation some days thereafter. You might use an ovulation prediction kit, or you might even use a shot of the ovulation trigger, HCG, to cause that egg to release. So now...
Methods. In this double-blind, multi-center trial, we randomized assigned 15 women in a 1 ratio to receive Letrozole or clomiphene for up to give treatment cycles with visits to determine ovulation and pregnancy, followed by tracking of pregnancy. The polycystic ovary syndrome was defined according to modified Rotterdam criteria and ovulation with either hyperandrogenism or polycystic ovaries. Participants were 18 to 14 years of age, had at least one patent fallopian tube and a normal uterine cavity, and had a male partner with a sperm concentration of at least 14 millions per milliliter. The woman and their partners agreed to have regular intercourse with the intent of conception during the study. The primary outcome was live birth during the treatment period.
So I'm finally going to make a video about PCOS, and the reason I have been making videos about other things and not PCOS is because I don't really have that much to say about it. Even though I was diagnosed 4 years ago, I just have nothing much to say on the subject. So my primary symptom was acne. I had acne all over my forehead, face, just everywhere. And it started when I was doing my A-levels, and I thought it was due to stress. And then I moved to my university halls, and it got worse and worse, and my skin was horrendous. It was awful, and it got so bad, and I was so self-conscious about it that if the fire alarm went off in the middle of the night, I would put concealer on, or I would open my door and go downstairs, because I was that upset about my skin. It was painful when I washed my face. It was awful. It was really bad. So I went to the doctor about it, and I was given like a month course of antibiotics. Had a roll on to put on my face, and neither of them worked. And then I went back again and again and again, saying, please give me something that's going to help my skin, because I feel really awful. And then I told them about another symptom that I had, which I previously not told them, because I was a little bit embarrassed, but my periods had stopped for about 3 months, and I thought it was due to stress from leaving home and moving to the university halls. And then the doctor said, I think you might have PCOS. She arranged an ultrasound scan, so I had the ultrasound scan, and you have to drink like 2 liters of water before you have an ultrasound scan. It's really uncomfortable, and I just kept thinking how ironic it was that I was having a scan that pregnant women have that could determine if I was infertile or not. But it was very ironic. And then about a week after the ultrasound scan, I was back at my university halls, and I remember me ringing the doctor and the doctor ringing me, and I was in my kitchen with 2 of my flatmates. And I thought if they were with me, then the doctor wouldn't give me any bad news. And she did. And then I ran out of the kitchen in tears, because, like I said in my other video about PCOS, I just thought, well, what we're going to do now? I've got PCOS, I didn't really know that much about it. I knew that it was why my periods had stopped and why I had horrendous skin. So in a way it was good because I knew how to resolve my issues, which were previously really annoying me. So I was put on Dianet, a contraceptive pill, and I was on Dianet for about 14 months maybe, and it took around 8 months for it to